I thought it might be helpful to further go into a little bit of detail about what you could expect on a visit here. What I do that's a little bit different, why it works, how it works. So remember, we're focusing on the TMJ, D, dysfunction. And what that means are people that have headaches, migraines, balance issues, ringing the ear, sinus, chronic sinus stuff, balance issues, chronic shoulder, upper back pain. This all is triggered by the nerves and the muscles that surround your jaw. Specifically, and I cannot stress this enough, the trigger points. I talk about trigger points all the time because that's what my expertise is. The trigger points are specifically areas in the muscles that refer pain all over the place. So you might say, Dr. Matt, why am I having pain in my sinuses and it feels like a headache that's all the time? Trigger points that are in your neck specifically go to that point. They refer pain inside the jaw, outside the jaw. So we'll discuss all that when you come in. I'm not going to go into a lot of detail. If my assistant Leslie would hand me, there's a bit of a model, so just so you get an idea of what's going on here. Your temporal bone, this area right here, TMJ, right? So that's a T. The M is the mandible. That's what we chew with, right? That's our jaw. And then the little blue thing, if you can see it, it's a piece of cartilage. The cartilage is a shock absorber. It's like the brake pad, right? It basically absorbs a lot of that shock that we use every day when we're talking, when we're biting. And a lot of people that clench their jaw at night and have what's called bruxism, which is when you're grinding your teeth at night, that's a stress response. So one of the things that we can do here, even though this is a mechanical manual release, right, of the muscles and the trigger points, is we can calm a lot of that down. Now, this is by no means saying that you should not see other practitioners. I 100% want you to continue seeing your dentist, your mental care providers, your chiropractors, massage therapists, everybody, right? What I do is a little bit more specific. It's very particular, and I want to help you feel better immediately on your first visit. You will absolutely feel better when you leave here. So, just to reiterate one more time, manual release of the muscles that surround your skull, right? Because there's all muscles here. The jaw, the neck muscles, your upper shoulders and middle back, they're all related to the TMJ.